Fox 45's Joseph Ojo looks into what medical experts say might be causing a downward trend of the flu. Joseph?
Kai, while it is not scientifically proven, doctors feel that our mitigation efforts to stop the spread of COVID-19, such as mask wearing and physical distance, is leading to a decrease in flu cases.
Influenza yearly is responsible for, large amounts of illness, large amounts of hospitalizations.
This year, that is not the case. A search on the Maryland Department of Health's flu dashboard will show although COVID-19 cases are rising, the other virus called the flu is decreasing.
It's dependent on a number of factors, including the predominant strains of flu that are circulating.
Take a look at this chart. In week 13 of the 2019-2020 flu season, you will see that the percentage of influenza-like illness infections reported was 6.7%. Let's now compare those numbers to that of the 2020-2021 flu season. In week 13, 1.5% of influenza-like illness infections were reported, much lower numbers than last year's flu season and even the years before.
One couldn't point to increased vaccine uptake for the flu as the cause of it, but there's a much more, I think, obvious change has taken place in society since last year.
That change in society that Chief of Infectious Disease at Greater Baltimore Medical Center, Dr. Theodore Bailey, is speaking about is the measures that we have taken to prevent COVID-19.
As a community, become much more aware of respiratory hygiene and hand hygiene as well, covering our face and mouth and nose.
Health experts say while it's not proven that our efforts to stop the spread of COVID-19 is the reason for a decrease in flu cases, the lack of travel and with many not gathering in groups of over 10 indoors is surely leading to influenza droplets not being spread amongst people.
Masking, with now widespread adoption of masking, that should be effective at preventing transmission of influenza, just as it is COVID-19.
And the Maryland Department of Health says that hospitals across the state test for multiple viruses and not just COVID alone, and they recommend that everyone gets a flu shot. Joseph Ojo, Fox 45 News.